The Non-Communicable Disease Control Unit of the Ministry of Health held a press briefing on Friday at the Central Medical Store in Kutu to update the public on ongoing enforcement efforts related to the 2016 Tobacco Control Act. The briefing highlighted recent measures taken to ensure compliance with the Act, which was adopted in December 2016 and came into effect on December 17, 2018. Key provisions including restriction on smoking in public places and bans on tobacco advertising, promotion and sponsorship were implemented immediately. Additionally, the Tobacco Control Regulations 2019, which outlined specific guidelines on health warnings, sales restriction, disclosure requirements and enforcement became effective on October 1, 2019. The Ministry of Health, in collaboration with key enforcement agencies, including the National Environment Agency, Gambia Revenue Authority, Gambia Police Force and the Drug Law Enforcement Agency, has been conducting joint operations to ensure compliance with the law. Speaking at the briefing, Michael M. Mendy, Director of Health Promotion and Education, emphasized the severe health risks posed by tobacco use.
Data has shown us that every year it kills about 8 million people. And out of these 8 million people, 1 million of them who are killed by tobacco use are those innocent ones who don't use it, but are exposed to it by those that are using it. This is a concern. And if you look at it worldwide, 80% of these deaths also occur in the part of the world we live in the low and the middle income countries, which Gambia is part of. Of course, this is a big concern and something that is modifiable. It's a risk factor that we can modify. And it's a risk factor that all of us will not cope with its effects.
Pasamba Bojang, Commissioner for Enforcement and Monitoring of Tobacco Control, reaffirmed the government's commitment to upholding the law.
This tobacco issue is an act of parliament, and we believe we have to make sure it is enforced as prescribed by the act. Yes, with issues we are facing, we have some constraints, like there is still lack of understanding from other community that shisha is part of recreational activities, particularly in the tourist site, which in this particular act, there is no specific jurisdiction that one have to use tobacco-related product freely. We are here not to say that the particular product is banned, no, but it's regulated where and how to use it. TDA is part of the Gambia, Republic of the Gambia, within the sovereigns, and by doing so, the act remains as it is.
Meanwhile, Sefo Singate, Program Officer for Non-Communicable Disease, underscored the dangers of tobacco consumption and its role in increasing the burden of non-communicable disease in the country.
The tobacco is causing harm to health, is destroying our health system, it is destroying our economy, it is causing a lot of economic loss to users and also to government and the family members, but also destroying the environment. So WHO and health ministries worldwide come up with solutions to fight against this product. First, they say there need to be measures to take the fight to the industry. One, let's sensitize our public on the dangers of tobacco use. Two, they say let's increase the tax on the product, because when it is very low, people will consume in high numbers, the prevalence will be high, young people will go into it. So you make the product very expensive to reduce affordability. And when affordability is reduced, demand is also reduced.
Reports from the Non-Communicable Disease Unit highlighted that NCDs pose a serious public health challenges in the Gambia, affecting nearly every household. The growing prevalence of risk factors is placing significant strain on the country's limited healthcare resources, while mental health issues and injuries remain the leading cause of death and disability. The rising burden of non-communicable disease is particularly alarming. 17.4% of adults in the Gambia are obese. 49% of the population suffers from hypertension. Diabetes affects 9.4% of women and 11.6% of men. Cancer cases have increased from 480 in 1997 to 1,035 in 2020. NCDs contribute to over 5,000 premature deaths annually, primarily due to cardiovascular diseases, cancer, respiratory disease, and diabetes. The major risk factors driving the increase in non-communicable disease include tobacco use, alcohol consumption, physical inactivity, and unhealthy diets. Currently, non-communicable diseases account for 34% of all deaths in the Gambia, underscoring the urgent need for strengthening prevention and control measures. Reporting for Kirfatu, I am Fatu Silla.